Everyone, another day, another session. Today we bring to you some basic information about dental crowns so that you understand your dental treatment better. I'm Dr. Bhavana Nair. I'm a prosthodontist by profession. I specialize in replacing the lost tissue of your oral cavity. Now what can be lost? It could be an entire set of dentition, it could be one entire tooth or even a part of a tooth. Let's focus on to the last part of that statement. The point where we think that we are going to lose or we have already lost a part of our tooth, what pops up in our mind is that I need to get a dental cap. Now that dental cap that you're thinking about is nothing but dental crowns. We understand what dental crowns are. Now what we need to understand is what materials are they available in, what types are there and where to be used and how to maintain it. These are the aspects that today I'll be explaining in this video so that, as mentioned, you understand your dental treatment better. Now we understand what dental crowns are. We need to understand who are the candidates who require a dental crown, what kind of materials are available, what are the types of crowns that is there, and also how to maintain if at all you're getting a dental crown. Now if you have undergone a root canal treatment, then you definitely should go ahead with crown so that you protect the tooth. Otherwise even a simple food that is not very hard also can end up with that you can end up with a fractured tooth. Next will be somebody who has had mutilated dentition. By that I mean if you are someone who has undergone excessive wear and you have a lot of sensitivity issues. You see that there was a time when your tooth were longer and now suddenly half of it has been chipped off. So second category people are those people who have mutilated teeth. So this can improve the functionality of your teeth if you're getting dental crowns in all the teeth. If you are someone with mutilated teeth, that means if you have noticed that there was a period of time when your teeth were longer and now suddenly a lot of it has undergone abrasion and it has undergone wear and the length of your teeth has reduced and you have a lot of sensitivity, then you should definitely go ahead with capping or crowning of your teeth so that the functionality of your teeth can be increased, so that your chewing can be better basically. Third will be if you're someone with fractured teeth, you have bitten onto something really hard and one tooth or maybe more than that got fractured. If you have encountered road traffic accidents and because of the accident you undergone fracture of your teeth and you're not very happy with the way you appear, with the way you look, then you can definitely go ahead with aesthetic correction, and that is something we do with the help of dental crowns. So now you know if at all you fall in the category when you should be going ahead with dental crowns or not. If you're going to go ahead, you also need to know what crown is going to suit you best according to your needs. So that is what I'm going to discuss in the next part of this video. Now there are many types of crowns available and they're basically based on the material with which they are fabricated. First will be all ceramic crowns. Now all ceramic crowns, ceramic is a tooth colored white material, so it's going to give you a crown which is entirely white, no metal inside. So this crown is basically for those people with high aesthetic demands, जिन्हें looks पे ज़्यादा priority है. So this goes without saying that if you are going to get crowning of your anterior teeth, जो सामने के दांत है वहाँ पे अगर आप crowns लगाना चाहते हैं, तो ऐसे treatments के लिए what we normally recommend is all ceramic crowns. This crown is aesthetically really very superior because it has the inherent ability to replicate the shade, the color and everything of your natural tooth. So even if you have a natural tooth next to the crown, nobody would be able to differentiate whether this is the natural tooth and this one is the crown. So that is about all ceramic crowns. It can also be given to patients जिनको metal allergy होगा. So in such kind of patients we go with metal free crown, that is nothing but all ceramic crowns. Next is all metal crown. With the name itself you understand that it is going to be made completely of metal. It's going to have a metallic sheen. So obviously we cannot be using this in the anterior region or for aesthetic correction. So goes without saying that it's going to be used to cap the posterior teeth. जो पीछे वाले दांत है उधर जो पीछे वाले दांत है उन दांतों पे we normally prefer giving all ceramic crowns. That is not very visible to the human eye. When you're going to interact with other people, the areas where it won't catch attention from the people you're interacting with, in those kind of areas we prefer giving all ceramic crowns. Now it has a very very good advantage that it is strong, so it is going to withstand your chewing forces. So that's why the heavy chewing forces जो normally पीछे वाले दांतों पे present होते हैं, वो area पे all ceramic crown लेना would be a very good idea. Next is metal ceramic crown. With the name itself, we understand that it has metal and it has ceramic. So we have an internal layer of metal, and then we have a layer of ceramic, the aesthetic material, the tooth colored material that is coated onto this metal. So you get best of both worlds. What happens is you have the strength of metal and you have aesthetics of ceramic. This is one of the most common options that people go for these days whenever they have to get their crowning done, because these days people don't want to compromise with the aesthetic aspect as well. So porcelain infused to metal or the metal ceramic crown that is present is a very good idea if you want to go ahead with crowning. Next is all resin crown. So this is the least expensive crown material that is available, but it has many drawbacks. So this is not the crown type that your dentist is going to usually recommend to you, because it has a tendency to fracture very quickly. It's going to undergo wear and it's going to undergo staining also for a long period of time. If you're someone looking for getting dental crowns for a short period of time for some particular reason, then you can go ahead with all resin crown, but this shouldn't be your first priority because of the drawbacks that I had just mentioned about. Another improvised version that you have is veneers. So dental veneers that is there. It's nothing but laminates. Now we all are very familiar to the term lamination that we do on papers. So you laminate the paper in the same way you can laminate your teeth as well. So laminate veneers, they are nothing but they are a layer that you add on to your front teeth. So it helps you enhance the appearance that you already have. So you have a very thin ceramic shell and you can adapt it over to your tooth, and the shape or the color according to your desire can be modified, and your look can be more appealing. So that is about various materials and various dental crowns that are available. And one very important factor that you need to know along with having knowledge of dental crowns would be the maintenance of it as well. So simple maintenance procedure that you follow can take you a long way. You have to brush twice after getting dental crowns. You have to floss daily, and it would be a very good idea to visit your dentist twice annually. If you are a smoker, understand that your plaque accumulation is going to be more compared to the people who do not do smoking. So it would be a good option for you to make more number of visits with your dentist. And yeah, all the other basic oral hygiene procedures that you follow, it should be reinforced when you're getting dental crowns or any other dental treatments. So that was about dental crowns. I hope this video was helpful for you. If there's any query in your mind, if there's any area that I have not covered you or felt, you can always get back to me in the comment section and I would be more than happy to solve it for you. Thank you.